Hello students, my name is Dr. Peter Richard Stevenson. I'm an assistant professor in the Department of Prosthodontics in Vinayaga Mission Sankaracharya Dental College. Today we'll be seeing a topic on the steps in fabrication of complete denture. So what is a complete denture? A complete denture is a dental process that replaces all of the natural dentition and associated structures of maxilla and mandible. It may be supported by mucosa or sometimes by dental implants. So there are certain objectives for a complete denture, that is the aesthetic component. It must improve the mastication, it must improve the speech, the function must be there without any interferences, preservation of oral structures and maintenance of health and comfort. Today we'll be looking at the steps in the fabrication of complete denture. So as an overview, we have to start with the tray selection, then comes the primary impression, then the primary cast, then comes the secondary impression, then secondary cast, or also called as the master cast. Then what we do is a denture base is fabricated, followed by which an occlusal rim is fabricated, which is then articulated. And after that, the processing lab procedures will be done, which is the setting of teeth, flasking, dewaxing, curing, trimming and polishing. Coming to the types of impression, first we do what is called as the primary impression. Then using that primary impression, we pour a cast, and using that we fabricate tray, using which we take a secondary impression. So these will be the two types of impressions that will be made during the fabrication of a complete denture. Coming to the impression materials, now there are different impression materials available over the period of time in the market and with the recent advancements. However, alginate is usually used for primary impression, or impression compound is commonly used for a primary impression. Now based on the impression material, the tray also will change. So for an alginate we use what is called as a perforated tray, and for an impression compound we use what is called as a non-perforated tray. Now coming to the primary cast, once your primary impression is made using whichever material, we pour it using certain materials like your gypsum products. Right. Now the steps involved would be to pour the plaster in the impression in 3 steps. This is done within 15 minutes after impression making. Then the base is poured. Now you can see that this part of the cast is the base. Now the base should have a minimum of 10 mm thickness, and pouring should be done from the distal end. Once that is done, finally it is trimmed. Now using this primary cast, a special tray is fabricated. Now the special tray is a custom made device prepared for particular patient, which is used to carry, confine and control an impression material while making an impression. Now these special trays are also called as custom trays because they are custom made for every specific patient. Using this special tray, we are going to take what is called as a secondary impression. Now this secondary impression is made, and this will be the final impression, using which a master cast will be poured, on which we will be fabricating the complete denture. Now coming to the secondary impression, the secondary impression must have a negative likeness made for the purpose of fabricating a prosthesis. It should have the finer details of denture bearing area at rest. Border molding is done, which is also peripheral tracing, and after border molding is done, we make what is called as wash impression, and post damming is done. Now while making the secondary impression, while making the border molding especially, we must make sure that the border molding movements are given perfectly, whether it is outward downward or outward upward, or lifting of the tongue or suckling or even licking of the lips. These are all intra-border movements which will be discussed when a secondary impression class is taken. However, when a secondary impression is made, care must be taken that every detail is replicated in your master cast, because this is going to be the intaglio surface of the complete denture, which will directly influence the retention, resistance and support stability of the complete denture. Coming to the tray preparation before the impression making, a wax spacer which was placed in your custom tray is removed, and 0.5 to 1 mm of tracing material is removed in order to give space for the wash impression, except in the posterior palatal seal area. Flanges and the border should be 2.5 to 3 mm thick. Drill holes are made in the tray to prevent tissue displacement during the impression making. Now this will be the custom tray. Border molding is done, the cast is poured. So these are all the steps in the making of a secondary impression, or also called as your final impression. So first border molding is done. Once border molding is done, what we do is we remove the wax spacer and we remove a little bit of the material, and then we add, this will be the impression material, which commonly is ZOE, zinc oxide eugenol impression paste, or medium body silicone elastomeric material can also be used, and then it is inserted in the patient's mouth, and there you have your final impression. Using this final impression, a master cast is poured. Now, this is a replica of the tooth structure or the residual ridge areas and other parts of the dental arch orofacial structures used to fabricate a dental restoration or processes. Now, this master cast, you can see, has beautifully replicated all the details, be it the ridge area, or you can see the PPS area, you can see the frenum, and everything is recorded. Coming to the record base, the base of the denture, basically, it helps in maintaining the dimensional stability of the denture and also the cast. It has to have a 1 mm thick on the crest and the facial slope of the ridge, 2 mm thickness in the palatal and lingual flange, and smooth and round borders. Coming to the fabrication of an occlusal rim. Now, in a complete denture, we see the placement of the teeth, but before the placement of the teeth, we need to have something that gives space for the teeth to be placed, for which we do something called as a jaw relation, right? Before that, we need to fabricate a wax rim which gives space for the teeth. These occlusal rims are occluding surfaces built on temporary or permanent denture bases for the purpose of making a maxillomandibular relation records and arranging the teeth. Primarily serves as the gingiva, and it is done mainly to arrange the teeth. Here is a pictorial representation of a occlusal rim. So the anterior part must be 22 mm in length, and posteriorly it must be 8 mm. Now, coming to the thickness, the width, it has to be 3 to 5 mm anteriorly and 8 to 10 mm posteriorly. Now, this is because we need lesser space anteriorly because the incisors are thinner compared to the molars, right? And when we are checking for the phonetics in the patient's mouth, we do not want a very thick wax in the anterior part because the patient will not be able to talk, patient will not be able to pronounce the word. So indirectly we might be impeding the phonetics. This is the mandibular occlusal rim. Here you can see anteriorly it has to be 15 to 18 mm, and posteriorly it has to be from the 2/3 of the retromolar pad. Like I said, 15 to 18 mm anteriorly. Now, coming to the width of the occlusal rim, anteriorly it has to be 3 to 5 mm and posteriorly it has to be 8 to 10 mm to accommodate the placement of the teeth starting from the anterior, the incisors, canine premolars, and the molars in the posterior region. Now, once the wax rims are fabricated in the laboratory, what we do is we place the occlusal rims in the patient's mouth and we do something called as a jaw relation. Now, the jaw relation, it is defined as any relation of the mandible to the maxilla. It is a relationship between the two jaws. There are 3 types. One is orienting, the second is to find the vertical, and third is to find the horizontal. The vertical jaw relation is nothing but in a vertical dimension to see the height of 2 reference points, which is the most prominent point on your chin and the most prominent point on your nose. And using this, what we do is we check the vertical dimension at rest and the vertical dimension at occlusion. Thereby, we can find out the vertical jaw relation. Coming to the horizontal jaw relation, we have found the jaw relation in the vertical aspect. Then we do what is called as a horizontal jaw relation. Here we find the relationship of the jaws in a horizontal dimension. The centric relations in the patient's mouth is something that is permanent. It doesn't change very much. So this is the most posterior point where the mandible occludes. So we need to find the centric point for the patient while we are performing the horizontal jaw relation. Once this is done, we mark the midline for the patient in the occlusal rim, and then we fuse it, and then we remove it from the patient's mouth. And then as you can see, it is fitted in the cast. Now this is now mounted and it is then articulated. Now coming to what is an articulation. An articulation is the procedure of attaching the maxillary and mandibular cast to the articulator in the recorded jaw relation. Now this recorded jaw relation is now going to be transferred into your articulator. This is what an articulator looks like. Now there are different types of articulators. It could be semi-adjustable, it could be non-adjustable, it could be fully adjustable. What we are seeing here is a mean value articulator. So those rims are now going to be mounted in this articulator and it is going to be articulated. Now what is an articulator? A device that may be adjusted to permit movement of the cast into various recorded eccentric relationships. This is a Hanau's articulator, is a semi-adjustable articulator which allows more freedom of eccentric movements. Now once it is articulated, we can start with the setting of the teeth. Now as you can see, this is a maxillary cast on which we place the maxillary rim, and we start placing the anterior teeth initially. We start with the maxillary central incisors. A template or a glass plate is placed in order to check the glass plate relation. Once one side is set, the central incisors, the laterals and the canines are set, we can now start with the other side. As you can see, the anteriors, maxillary anteriors are placed and the glass plate relation is checked. Once that is done, you can start placing the posteriors. Now you can see here that the complete placement of the maxillary teeth is done and the glass plate relation is checked. And here you can see the mandibular posteriors and the mandibular anteriors are also set. So the teeth is set in such a manner that it doesn't impede with the muscular forces of the patient's mouth, because the teeth must be set in a neutral zone, because the patient's muscular forces, that is the buccal mucosa, the labial mucosa and the lingual mucosa, has to be in complete harmony to allow the stability of the denture and allow peaceful mastication for the patient. Here you can see a completely set articulator with teeth setting is done completely. You can check for eccentric movements once the teeth setting is done. Once the teeth setting is completed in the laboratory, what we do is we place it in the patient's mouth and a wax trial or a try-in is done. Now you can see that this is the denture base with the wax and the teeth. Now this is again placed into the patient's mouth, maxillary and mandibular. Now once this is placed, we check for occlusion, we check for phonetics and we check for aesthetics. Now what is phonetics? Phonetics is nothing but the pronunciation of certain words like fricatives or sibilants or labiodentals or labioalveolars. So when the patient spells these words, let's say like S or F or V or T or D, we know how well the teeth setting is done, and if there is enough space when the patient is pronouncing these letters. And we check for aesthetics, like we check for the labial fullness, we check the smile line, and we ask the patient if the patient is satisfied with this. So this basically acts like a trial for the patient before the final complete denture is fabricated. We also check for the occlusion because we want it in a class 1 molar or canine relationship. So once the wax trial is done and the dentist and the patient both are satisfied, the denture is processed. Here on, it is a laboratory procedure. Now this wax trial is taken out from the patient's mouth, placed on the cast, and this cast is now taken into the laboratory for processing. First process in laboratory processing is flasking or investing. This is a process by which trial denture is surrounded by stone or plaster in a metal flask. It basically creates a mold for acrylic denture. Now this metallic structure you see here is your flask. Now the cast is placed and you can see this is the plaster is poured, and this acts like a 3-part mold basically. That's what happens. So first we do flasking. Once flasking is done, we do something called as de-waxing. Dewaxing is, you can see that there is wax. Here there is wax which was used for the occlusal rims and placement of the teeth now has to be replaced with acrylic. So in order to remove this wax, we do something called as a dewaxing, so that wherever wax was placed, now that place is replaced with acrylic. Dewaxing is, it eliminates the wax and temporary denture base for the mold space. What is done is it is placed in boiling water for 5 minutes, and the excess time in boiling water causes wax to liquefy and soak in stone. So once the wax is liquefied, the flask is opened and flushed with boiling water to remove the remaining wax. Now when it was flasked or invested, you can see the wax here in all these places except the teeth is now flushed out completely here. Once dewaxing is done, packing is done. Packing is nothing but placement of the acrylic material in space where wax was previously found. Now apply a separating media on the stone surface excluding the teeth surface, and acrylic dough is mixed and rolled and adapted into the mold space, into this space wherever wax was placed previously. A plastic separating sheet is placed over the dough and two halves are closed with pressure. Now once acrylic is placed, we place a sheet of polythene, plastic separating sheet. So when the acrylic is packed into the mold space, it looks something like this. Next we do something called as curing. Curing is nothing but polymerization of the acrylic material. It is defined as forming of a compound by joining together of molecules of small molecular weight into a compound of large molecular weight. So you can see the dental model or the cast and the acrylic on the two different parts of the flask. Now this is placed into hot water for curing. Once curing is done, deflasking is done. Deflasking is nothing but the removal of the denture from the flask using a wedge instrument. Now you can see the denture is now finally fabricated. The acrylic is polymerized or cured. So once we remove it, we can check for high points, and once high points are all checked, we can do the trimming. The excess of acrylic that is formed, you can see in these regions a little bit of excess is formed. All these are now trimmed using different types of trimming stones and burrs to reproduce the accurate details. Abrasives are used for polishing and finishing of the irregular surface. Once trimming is done, we do something called as polishing. We want the denture to look very neat, clean and polished in order to prevent debris and food particles to accumulate on the denture surfaces. A slurry of fine flour of pumice with water is made, and as you can see in this picture, this is the rag on which pumice and water is mixed, and it is used for the polishing of the denture surface. The rag wheel is wetted using a slurry and polished at a low speed. This is the rag wheel. You can see here, this is fitted to a lathe machine and it is run at a low speed, and it is used for polishing of the surface of the denture. In case of less accessible areas, a brush or a profile cup with slurry is used for polishing. High shine is produced using number 341 tie gleam. So these were all the steps that were involved for dewaxing, flasking and curing. As an overview, let's go through what happened. First, it was flasked and the second pouring was done. You can see the lid is closed. Then dewaxing is done. Once dewaxing is done, it looks like this. The wax is all removed. Wherever wax was there, acrylic is now going to be replaced. Once acrylic is placed, again it is closed and it is sent for curing. Once curing is done, the denture is taken out of the flask, which was deflasking, and the excess is trimmed. Now the denture is polished. Once polished, the final denture looks like this. That's all for the steps of fabrication of a complete denture. Thank you for watching my presentation.